If you are a dialysis patient, there's a substance in the blood that can spike and cause cardiac arrest. This substance is called potassium. The danger is that many dialysis patients don't know the early signs of high potassium in the body. In this video, we'll discuss the main symptoms of high blood potassium, why it happens to dialysis patients, and how we can safely reduce it. At the end of the video, I'll share a method to help you remove potassium from most vegetables we eat. Watch until the end because this video is very important for your health. First of all, what is potassium? And why is it important? Potassium is a very vital mineral in the body. Its main function is helping nerves and muscles perform their essential tasks, especially the heart muscle, so it can function normally. In a healthy person, the kidneys get rid of excess potassium through urine, but in kidney failure patients, the kidneys can't eliminate it. So potassium levels increase in the blood, and that's the main reason most dialysis patients are prone to high blood potassium. So what are the early symptoms of high blood potassium? In many cases, high potassium starts with mild symptoms, but the problem is patients don't link these symptoms to high potassium, and that's where the danger lies. Key early symptoms include muscle weakness, a constant feeling of fatigue and exhaustion, numbness or tingling in the hands or feet, persistent nausea, and a general sense of unease. These symptoms can be mild, especially at the onset of high potassium, but they are often the start of rising potassium levels. Now, what are the serious symptoms you should watch out for? If potassium continues to rise, symptoms can become more severe. Most notably, 1. Irregular heartbeat. The heart rhythm becomes irregular. A feeling of intense palpitations. The patient complains of palpitations or fluttering, chest pain and pressure, severe muscle weakness. In severe cases, fainting can occur. In some extreme cases, high potassium, God forbid, can lead to cardiac arrest. That's why monitoring potassium is crucial for dialysis patients. If this information was helpful and new to you, please like it now, as this helps the video reach more people. Let's continue. So what is the normal range for blood potassium? The normal range is between 3.5 and 5.5. This is considered high potassium. If it reaches 6 or more, it's very dangerous, especially for dialysis patients. That's why potassium tests are among the routine tests for dialysis patients. Why does potassium rise in dialysis patients? There are many reasons for high potassium in dialysis patients, the most important being irregular dialysis sessions, meaning you are skipping your dialysis sessions, eating many meals that are full of and rich in potassium, which we'll discuss in a moment. Also, some medications contain potassium and can cause this. That's why we as nephrologists always advise dialysis patients to follow a low potassium diet. So what foods might be raising your potassium that you eat regularly? There are many foods high in potassium, but the main ones are bananas, oranges, and potatoes. Avocado. This doesn't mean these foods are strictly forbidden, but caution is needed when eating them, especially for dialysis patients. Now, if I'm a dialysis patient, how can I lower the potassium in my blood? There are a few steps we can take to do that. First, strictly adhere to your dialysis sessions, meaning you take your 3 weekly sessions and complete the full 4 hours on the machine. Second, follow a low potassium diet. Avoid salt substitutes that contain high levels of potassium. Stick to the medications prescribed by your nephrologist. These steps keep potassium at safe levels, especially for dialysis patients. Most vegetables we eat have a high potassium content, but there's a specific way you can reduce the potassium in vegetables before cooking them. This method involves boiling the vegetables in water and then discarding that water, and then you can cook them however you like. This method is very effective at reducing the potassium levels in vegetables. If we combine all these instructions, we can offer a take-home message for the dialysis patients listening. High potassium is one of the most dangerous complications for a dialysis patient because it can actually cause the heart to stop. But the good news is that detecting this is very simple through regular blood tests, along with your commitment to a low potassium diet. Attending your dialysis sessions is essential and helps keep potassium within safe limits. My advice to you, if you are a dialysis patient, regularly monitoring your potassium is a vital step in protecting your heart and body. Take care of your health. Your health matters to me. And remember, we made this video today with the best of intentions. We hope you've also done something good today. Like, share, and help others. And I'll see you next week to check in on you and reassure you. Stay safe.